So 2014-15, I think has been a very good year for Powys, and I'd want to share with you a year in pictures, really, highlighting the areas where we've progressed well and where success has been achieved, but also to pick up and share with you those areas where we need to do more work. So just thinking about what our vision and aims are, if we could just go back one. Thank you very much, John. What's the Health Board here for? It's two key things. One is to help improve the population's health and well-being. We're not just a sickness service, we're also a health service. And we put a lot of stall in terms of trying to help people to live healthy lives and prevent illness. But we're also here to secure really high-quality services for the people who live in Powys, whether that's when we provide it ourselves in some of our community hospitals, our community teams, whether it's general practitioners, whether it's pharmacists, optometrists, whether it's the independent sector providing care to people in care homes, or whether it's in district general hospitals. Right the way across the board, our job is to secure really high quality services for the people of Powys. And our ambition and aim is to ensure that we've got truly integrated care for that individual. So, ideally you see no seams in it. It is seamless. Now I know we've got quite a long way to go on that, but that is really what we're trying to achieve. We seek to do that through 6 key aims, and you will see those when you read the annual report. They will shine through. The first of those is to improve health and well-being, seeking wherever possible for people to live healthy lifestyles. I was delighted to see later on the agenda we've got a session on that. And I did ask Stuart just before we started whether we needed our running trainers or anything, but he's reassured us that it's not going to be too strenuous. So we look forward to that slot. Secondly, and probably the biggest issue that we face on a day-to-day basis is accessing services. There's not one person in this room who hasn't travelled, I'm sure, the length and breadth of the county and sometimes the country at times to access those services, and particularly at the more specialised service end. Our aim is to provide as many services as we can locally and safely, reducing the need for people to travel out of county quite so often. That's a real challenge for us, but we are up for this, and there's a little bit more we can share with you on how we're doing. We also want to strive for excellence. We think the people of Powys deserve that, and we deserve that as the local health service. And we've got a clear ambition to provide excellent healthcare. And for those who provide services on our behalf, we want them to be providing excellent healthcare. I would endorse Viv's comments in that it is great to see so many people, because one of the things that Powys is about community. It's such a strong sense of it, and often you perhaps won't realise how strong that is until you go to different areas. And I feel very proud to be part of Powys communities when we're doing our local NHS work. So this is your NHS, and we want to work with groups and communities to shape the best services we can for Powys. Making every pound count. Viv mentioned the money. We'll come back to the money, and I think we still are living in very austere times. We have had a history of having very difficult financial position, and it's absolutely right to recognise the efforts of the previous chair, the previous chief executive, Bob Hudson, and the director of finance and the whole executive team and other key stakeholders in helping us to try to manage the money, to argue for the people of Powys that we should have had a higher allocation. And we'll start in more detail shortly. And then, of course, so important is the work we do collectively with staff as a team in Powys, valuing, developing and supporting them to be the best they can be in order to provide excellent services. I've got a slide on staff, which I think is one of my most favourite slides here today. Staff recently made a short film explaining why they love their job. It is well worth a look, and just in case anyone might think this is soft and fluffy, let me tell you that staff who are satisfied with their job give better care. Better care saves lives, and it's as simple as that. So happy staff, happy patients. And my own personal thanks to all staff who help to drive forward our services locally. I've got to say the commitment of staff at every level, senior managers, middle managers, people who are day in, day out dealing with patients is extremely high, and I think that puts us in a really very positive position moving forward. So thank you very much, and I'm going to hand over to Rebecca.